So welcome back. I'm very pleased to introduce Professor Patrick McNeil. Professor McNeil is the Deputy Vice-Chancellor for Medicine and Health at Macquarie University. He's also the Executive Dean of the Faculty of Medicine, Health and Human Sciences. He's held many leadership roles in all three areas of academic medicine, including clinical care, research and teaching. Thank you, Professor McNeil.
Thanks very much, Farah, and on behalf of the Faculty of Medicine, Health and Human Sciences, I want to welcome everybody to Macquarie University. I want to spend this session is about the team leaders, so three of the key leaders in the Centre for Health Informatics, and you'll hear from each of them about the research they're doing, and they're three pretty stellar leaders, I can tell you, having sat on promotion committees as they've come through promotion within the university. I've seen, some of their excellence firsthand. One of the most pleasurable jobs about my job is having the Australian Institute of Health Innovation as part of my faculty, and having them as a powerhouse of intellectual and academic excellence is very pleasing. And before introducing Farah, who will give the first presentation, I just wanted to give a few reflections on the word innovation, which is a key part of the Institute and a key part of the Centre for Health Informatics. And it's one of the 6 values that guides our work at MQ Health here at Macquarie. And it was about 20 years ago, actually, that I actually went to a course at Harvard University, at Harvard Medical School, where the focus was on innovation. And one of the people directing that one-week course that I went to was Clay Christensen, who's now deceased, but at the time was a professor in the Harvard Business School, even though the course was run by Harvard Medical School. And most people will be aware of Clay Christensen's books on innovation. And he was the one who coined the term disruptive innovation, which at the time was a little bit controversial. A lot of innovators didn't like the word disruptive as the adjective. But when I think about innovation, and what I learned from listening and working with Clay Christensen over that week, was that often innovation comes from another industry into an industry. It comes from another player that's not a mainstream part of the industry. Because they produce a product or a process or a thinking that disrupts the way that industry thinks about it. And when I think about the health system, and I've been part of the health system for a long time, as many people in this room and online have been, there really hasn't been real innovation, I don't think. Not in my lifetime. And that's because health systems in Australia and across the world are essentially designed by the providers of care, not the receivers of care. But I predict that innovation, when it does come to health, will come because someone will produce an innovation that talks to the consumers of healthcare. So that's the challenge that I put out, and I'll be interested in maybe in Annie's talk, who is focused on consumers and where informatics can play a role. I think that's the opportunity I see, is when will there be an app on my phone that me as a user of healthcare is going to make my journey easier, is going to make my journey through health more pleasurable, more easy, more simple, some advantage that we as the providers of healthcare aren't thinking about, because that's where real disruptive innovation comes.